So this afternoon, we've got an agenda that is talking about mostly legislative stuff, but we're starting with what we talked about in the morning segment. One of the partners that we really need to have in being able to move the CON agenda forward. We can't do this just by hoping that we're going to do more of the same. We have to do something.
Hope and change?
No, I do not. We have to do this a little differently, and the different tact we already heard from Melissa Faust about grassroots. The other I think essential partner in this is the business community, and I have had the opportunity to engage with the Job Creators Network. And their CEO and president, who's Alfredo Ortiz. We both share a common benefactor, which is the Marcus Foundation, and we're both stepchildren of the Marcus Foundation, and so this was a natural. I guess, marriage of the Job Creators Network and the Docs for Patient Care Foundation to find common ground so that we can work together. This is one of those areas where this was a no-brainer for me, and when I had the opportunity to talk to Alfredo about how this was something that was a job killer for employees, and it was it was killing businesses from a cost standpoint. It was so obvious to him. So I'm not going to take up any more of his time. I'm going to let him tell you what he sees as the role of business in helping to make a difference in advancing CON reform around the country. So Alfredo, take it away.
Thank you, Hal. Appreciate it. Thank you, everybody. And I'm going to walk you through a little bit specifically about Job Creators Network. I do want this to be iterative, though, because I really want folks to be able to tell me what I can do to help you, help Al and the rest of the community kind of push this ahead. Because from my perspective, this is probably going to be one of the shortest presentations I can give because this is a no-brainer. I mean, it literally is a no-brainer. I don't even understand why it's even a discussion. But I'll start off because this kind of probably sums it up best with one of my favorite quotes from one of my favorite presidents, which is Ronald Reagan, of course. And it's, "I'm from the government and I'm here to help." Right? That pretty much sums it up, the whole thing. That's why this thing is so screwed up. 1974, right, which is when what was that called? The National Health Planning and Resource Development Act passed, right? If you think back to 1974, I think that's when Apple came up with the idea of a personal computer. Right? How much has advanced in that side, and this is still kind of lingering along. So, I mean, this is how far back we are in terms of the thought process and the thinking that needs to take place here. And unfortunately, with all the healthcare debate that's taking place just down the street there in the Capitol, we still aren't talking about how to bring costs down. And that's unfortunately the one thing that happened with ACA. It never really did anything to actually bring costs down. And something like this, that makes so much sense in the world to actually do. I just don't even understand why it's a discussion. But so again, I want to be able to have time to have input from you of what I can do to help. Again, I've got some ideas that I want to throw at you that say, is this helpful? Would it help? Hal and I did an op-ed together. I'm happy to do more of those. And I understand from the morning session, I apologize I couldn't make it in the morning. But there were some great ideas that were thrown and discussed. I'm happy to talk to anybody, and I'll give you guys my contact information. You guys have ideas and you think I can work with you and help you, please let me know. That's really why I'm here today. So I'm going to talk to you a little bit about Job Creators Network and the voice of small business, because I think at the end of the day, it's not really about big businesses here. It's about small businesses and entrepreneurialism and introducing entrepreneurialism into this industry and disruptive innovation. And quite frankly, again, it's not really rocket science. I mean, basically, it's saying as you introduce more competition, you're going to lower costs. I mean, I don't know how the government could ever expect that if you reduce supply, you're going to bring costs down. I mean, this is just completely against any model of economic theory that's out there. So it just really is so nonsensical, it's not even funny. So when we talk about small business, though, we have about 29 million small businesses out there that employ about 60 million people. So the number is roughly between 85 to 90 million people are impacted by small business in this country. Entrepreneurs, many of you who are yourselves and folks that we've talked about and that we hear like in Oklahoma, what a great model that is. There are opportunities to really leverage that small business platform, I think, to really bring disruptive innovation to the industry. And so what can we do to try to take out those regulations is, I think, the main thing that I can do to help all of you here. Again, small business create about 2/3 of new jobs in this country, which is incredible. And they have about half of all existing jobs. So again, very, very important from a small business perspective. But they're struggling. And they're mostly struggling through overtaxation, overregulation, lack of access to credit. I think all three of these things are relevant to everybody here in this room, but the most important thing, I think, is the overregulation piece. And that's what we're talking about here. This is simply a matter of overregulation and what a simple fix it could be to really kind of leverage things and get things going in the direction we need in terms of bringing costs down. Again, I'm going to walk through this quickly, but things that you probably all hear, I'm kind of preaching the convert in terms of small business and impact of healthcare costs to a lot of small businesses. It's pretty amazing. A nationwide poll of small businesses found that 3 out of 5 respondents said the healthcare law and other regulations are preventing them from hiring, raising wages, and really expanding their businesses. And so really the healthcare piece, we went on a big tour, for example, last year. We had about 30 stops around 20 states, talked to 8 different governors, about 22 different House representatives. Actually, Senator Alvarez was part of an all-day tour out in Georgia talking about these different elements. But it's so important, right, to talk about overregulation and how it impacts small businesses and entrepreneurialism and innovation in our economy. And again, I can't think of a better poster child than Khan as one of those regulations that's really holding back innovation in this industry. Again, one of the small businesses' biggest costs really are healthcare costs. When you look at these numbers, about $6,000 for single coverage, $18,000 for families. Roughly, this is an enormous line item for a lot of our small business owners. And when we went out on tour and talked to hundreds of small business owners, this was literally one of the top things that they talked about. We can't afford anymore to provide the types of benefits because of Obamacare, the Affordable Care Act, and the different regulations. We can't afford to offer the benefits that we used to be able to offer to our customers. And this wasn't just Republicans. This was Democrats, Independents, Republicans. And you could hear the true pain and angst in their voices that they couldn't provide the benefits that they had once before been able to give to their employees. And that was the real heartache of going out and listening to this. When you have things like Khan that are out there and very what I call simple fixes to make this thing move forward, it's mind-boggling and quite frankly absurd that certain special interest groups are really the ones that I think holding it back. Eliminating Khan would bring down these costs tremendously, benefiting small business and the economy. Again, I'm preaching the converted, so I'm trying to move along here. Healthcare represent, again, as I mentioned, healthcare costs represent the largest line item on many business P&L statements. I mean, it really is an enormous, piece of the P&L. And again, some great efforts are obviously being put forth right now, just steps away. But things like this have to get incorporated. I'll say the tort reform is something that we've actually also talked about. Loser pays is something that as an organization we're going to want to keep pushing forward. We think it has to happen in this country. I think combine we talked about this. Wasn't it about 20 to 25% roughly is what we're calculating between defensive medicine and loser pays is kind of
25%
right.
of the healthcare costs in this country are attributable to defensive medicine.
Right. And so that's the kind of stuff that's what we should be focused on, right? I mean, a lot of this stuff could take care of itself. How do you help more people in terms of providing coverage, right? How are you going to find? It's not by taxing people, it's by taking out some of these costs or addressing some of the things that are driving the costs. Again, something as an organization, if there are folks here in this room that are interested in taking that on, please let me know because we're looking again for partners to help on that front. But Khan's also, the Khan also diverts into the most expensive side in the healthcare delivery system, the hospital. And when you really look at that, the hospital care system, it really is amazing. I know in Oklahoma we've got a great model, what I call a really disruptive model of innovation that really puts it out there and says, this is the way we can do it. And this is frankly the way we should move forward on from an Affordable Care Act, so to speak. We should have been moving in this direction all along. I think we would have gone a long ways to reducing costs. So again, it's amazing to think, a lot of these laws make medical entrepreneurship illegal or just is discouraged because of what you need to go through the process. Depending on the state, dozens of devices and services, as you know, require cons before small businesses can provide them. And again, great entrepreneurialism and great ideas come from these small businesses. They're looking at different ways of finding opportunities that can really help the economy, help people, the country, and themselves. And there's nothing wrong of making profit off of this as long as you provide a value for it. And I think the biggest issue that we have with Con is that it is taking that idea of entrepreneurialism away from the individual, and frankly is really hurting the patients because at the end they have no access to other care, and that's what I think is the biggest issue here. And again, I encourage input in terms of how can we as Job Creators Network, when we put out op-eds and we have surrogates that are out there talking about different issues that affect our small businesses, how we can get even more of that information out there, and hopefully that's through your input. Again, it also raises healthcare costs for small businesses and consumers. Like I said, this is really one of the biggest issues and challenges that our small business owners said on our road tour. How do we bring these healthcare costs down? I mean, it was clearly evident to them that the ACA did nothing to that. And the only thing they saw was their premiums going up, their employees' premiums going up, the deductibles going up. And so nothing in terms of what we had before was really driving these costs down. So I think this is a big part. How did you also say this contributes roughly to the cost by having these this regulation in place, Con?
Certificate of, I don't know if anybody put an actual figure on what the cost to healthcare is, but again, it's intuitive. It's a no-brainer. That if you've got something that's restricting competition and allowing hospitals to keep their costs up, and care is being driven into the hospitals due to all the regulations. I mean, this is just alignment of the stars.
And it's interesting. I think one of the things as we were researching this whole topic, I think that actually is one of the things we should talk about, what we can do. I mean, we're here at Heritage Foundation. We have some great fellows here. There really wasn't that much that actually defined what the true cost was of Con, for example, as it exists today and the impact it's having on healthcare costs. That would be an interesting thing, that if we could actually drive a study or commission a study that actually talks and puts a value to that, I think you'd be pretty surprised.
I think you're right.
What it would be, because that was something that was missing as we were searching for information as we presented. And again, it encourages cronyism against vested interest. I mean, this is the biggest issue of all. I mean, when you look at who's actually defending this, look, it's the hospital lobbyists. And it's a great system because when you look at it in some cases, it's 8-fold, 9-fold more. Again, I use the Oklahoma model as kind of the best model that I could find that has a true entrepreneurial model, posts its prices. And when you look at comparable things that are actually out there, in some cases, again, it's 7, 8 times, 9 times more. Versus what's taking place in Oklahoma. Imagine if we could put that model in place across the entire country. Even just anecdotally, it's probably 15-20% easily. You could probably bring down costs by doing that. And again, it should be eliminated, we believe, to make it easier for entrepreneurs to fix the broken healthcare system. I mean, if we could unleash entrepreneurs onto this system, onto the healthcare system, it'd be amazing. And I think one of the reasons we have so much trouble is there's so much regulation. Entrepreneurs don't want to come by it. It's much easier for them to do some, roadie or something, how to pick up a package easier. I mean, there's more thoughts on entrepreneurialism going on things that don't affect the lives of Americans every single day than there is right here. So it's very, very concerning from our perspective. Again, as you guys have been hearing this, and this continues, as a number 47 counties right now have no insurers in individual market. A third of counties only have one insurer in individual markets. Again, the healthcare market in of itself and the insurance market is collapsing, and we know that. And there's a lot of discussion that's taking place, obviously, in terms of what we're going to do, how we're going to fix it. What's that new model? What's the new version of the ACA? But again, without bringing costs down, that's one of the most fundamental things we need to start with, is bring costs down. Because if you bring costs down of the actual healthcare industry, you can provide more of it. It's a very easy and simple thought process. It's not a rocket scientist to figure that one out, right? If I have $100 and it costs me $100 to take care of one person, that's the only thing I can do. But if I can bring that down to $50, then I can take care of 2 people. And so it's a very easy model. I really, as an former business person, turned I guess what do you call it? What do I call myself? An activist businessman, I guess now. It just makes no sense to me. I mean, this is if I were running a business, I'd be fired a long time ago. The healthcare industry continues to be one of the biggest opportunities for entrepreneurs and investors. Any hungry entrepreneur or founder plotting their next move would be foolish to not at least have a deep dive in the fast-growing and slow-to-evolve healthcare industry. I mean, it really is amazing. Again, I go back to the 1974, which is when that act passed. That's when they were coming up with Apple. I mean, you think about the computing power that sits in this one little phone already, and we're still talking about something that happened in 1974. as a model that a lot of states use. I mean, it is really mind-boggling. And again, I think reducing con is one of the best ways to be able to provide some disruptive innovation in this industry by unleashing entrepreneurs in something that, frankly, I think they're just staying away from because they can do much more with their time and provide much greater value with other things that, frankly, aren't as regulated. It'd be interesting to see if Apple would have done the same thing if it was as regulated. I wonder how much less entrepreneurialism and innovation would have existed in that industry if they had the same level of regulation. So, again, this is another thing that we threw out there, in terms of impact even on nursing homes and stuff like that. I mean, huge, huge issue that's going to be coming up. We're going to need entrepreneurialism. We're going to need people really thinking this through. Again, to the extent that we can have con taken away in the states that exist, I think this will just continue to unleash, people thinking about models differently that are going to help drive these costs down. And the lack of success really in controlling these costs is just out there. And a lot of the stuff, for example, from George Mason that we saw, really some amazing models that goes through and says, this just isn't working. Every single thing, I went through the regulations of what was the intention of it. Great intentions, but it didn't do a single thing to address any one of those. And it's amazing then, again, 1974 to where we are today, and we're still talking about it. I mean, this has to be one of the biggest failures that I've ever seen from a government standpoint. And there's no clear reason to expect that the basic laws of supply and demand would not apply, either when the states enacted the con laws or today. And again, it's simple supply and demand. If you have less of something, it's going to cost you more. If you have more of something, it's going to cost you less. And so again, as a representative of small businesses in particular, but also of other businesses that are part of our network, we're here to talk about what can we do better? What can we do differently? How can we work with you, your organization, others in this room to really try to drive this? Because I think it's going to be a grassroots effort. I'll tell you that we're working with several of the AGs across the states on different things. I think this is something that AGs should be very interested in terms of what they can do to help drive this out of their states and those states that still exist. Because I think this really is an AG effort, if you think about it, or even from a governor. I mean, this is directly impacts the health of all of their citizens in every single one of their states, and flies directly against entrepreneurialism, and quite frankly takes away the opportunity to folks to work to drive these costs down. So, you got my commitment at least that I'm going to work with our connections and the folks that we have in the AG offices to try to at least inform them of this, make them aware of this, and hopefully make it an issue that they take on. But again, it's something that as our organization, we're going to make sure that we continue to drive things, and great articles like we did together, we're going to continue to do, and hopefully make a difference there. Again, I think as we look at the con laws, as we're able to reduce these, we're going to be able to take cronyism out of the system. This swamp, so to speak, that we keep hearing about, it's a pretty big swamp, and in some cases it's more like quicksand. I was telling a friend last night, and you got to be careful because this is what's happening, and so we got to be able to save the system and pull it out of it. Widespread evidence that existing competitors use the con process to forestall entrepreneurs from opening their market. I mean, it really is pretty obvious. I mean, at this point, in terms of the research that we were able to find, that's exactly what it's being used for. It's being used to keep competitors out of the system and to keep a fairly profitable model in play. And all the other side reasons of why you should have that out there, which is, it helps the public safety, it allows the poor to have better access. I mean, I think, again, looking at the George Mason research in particular, I think all that's been proven wrong. That just doesn't exist. And so I think the best way to be able to help people out across the board is by increasing entrepreneurialism and increasing the competitiveness of that marketplace and allowing for that to happen. So again, we're going to be encouraging, at least from our perspective, all the folks, and you'll start seeing more from us on this as well. Again, I mentioned Oklahoma. The Surgery Center for Oklahoma, I think, is a fantastic model. When you look at some of these things, by posting it, in some cases it's 5 to 10 times less than hospitals right down the street. And the only reason I think that exists is because they have a clear, transparent model, and unfortunately they're not beholden to a lot of the special interest that the other hospitals are. So again, if you can use that as a model and we carry that across and we help governors and attorney generals across the board, because to the extent one of the things we're looking at is a federal issue versus a state issue, we actually think there's probably a bigger opportunity to affect this change at a state by state level than it is at a federal level. So I think that's one of the things we'll start looking at as well as state by state level. And again, price, competition, entrepreneurship, customer service markets, this can all fix the healthcare system, we believe, but only in the states that allow it. And I think what we should really try to do collectively is to shine a light on those states that are continuing to push the con laws in there and make them aware and make the citizens aware of how it's actually hurting them. Because I think that's very, it's easy to say that insurance companies are bad or pharmaceuticals are bad and stuff like that, but nobody really thinks that the hospitals necessarily are bad or the system itself, the government that is there to protect them is actually hurting them. So that was it. Like I said, it was relatively short from that perspective because I really want input. That's what we're looking for. I want folks to have ideas, recommend, throw things at me. I'll write some stuff down, and again, I'll be towards the back there giving business cards for whoever wants to connect with me. Yes? Oh, so there we go. I mean, it's clear, right? I mean, why touch it? I mean, there's so many other things that they could spend their time and monies and resources on and get much higher return on. The regulations are so unbelievably obstructive from this perspective. So thank you. That's a great quote. I've got to make sure to grab that. Yes, ma'am.
Yeah, I recently talked with a medical student who is part of a startup with a small company. So it's not just like surgery centers or do you want to have a new CAT scan or scan the hospitals, but it's these other little supportive new entrepreneurial efforts that are getting out that can't get into the big hospitals. They're not interested. They're not nimble. And when you allow some of these other things, smaller businesses to develop by removing the con laws, just the whole watershed of that effects because they'll be more experimental and a number of other entrepreneurial things that aren't the primary ones, but the secondary ones
Right.
will work with them. It's just a whole huge watershed.
And again, we need to be able to highlight that more and again, make more and more examples of that. I know Senator Alvarez is going to be talking a little bit about Georgia and what can be done there and what we are doing there. But again, I think we just need to do more and more of that because that's the type of
like
entrepreneurialism.
The DVC docs are just lapping up his product, but he cannot get any kind of
Right.
interest with these large hospitals, huge physician.
Right. I mean, and that's, I think, a problem that's existed at least over the past dozen years. I think FDA and a lot of different processes in medicine and stuff like that. I mean, the regulations are really killing entrepreneurialism in this industry.
The regulatory state that needs to be turned back, and I know that that's a big goal of Secretary of HHS to turn back some of the regulatory stuff. But you had mentioned, Alfredo, that needs to be done at the state level, and I agree that that's primarily the focus. But I think, and I mentioned this in the Wall Street Journal piece, the federal government played a role in creating this monster, and I think that they can pressure can be put to bear on them to try to undo this by tying Medicaid block grants, if we get to that point, to repealing CON in their states. And I think we need to continue to say that over and over again. And you know, the more that it's said, the bigger the echo chamber, I think the more that idea will catch on.
Well, and I don't think it even needs to be part of the big bill, so to
No.
speak. I mean, that could be a one-off thing that can be done tomorrow. I mean,
Right.
technically, say all future payments are going to be tied to repeal of con in your state.
Right, and I think that all of us who work in that arena, that should be something that we include, and we'll talk about that this afternoon in strategy. But I think that should be part of the messaging.
Yeah, I agree.
I think one of the important things that you point out, one of the reasons why Surgery Center of Oklahoma is so successful is because of its relationship it has with the business community. Because if you're working, expanding access to care in a fixed price system like Medicare system, all you're doing is doing more of expensive expensive things. They're
Right.
not actually bringing down cost.
Right.
There was a comment earlier about you're competing now on quality, which is an important factor, but it's in the self-funded business world that you're really starting to see this competition on cost that's really driving down because the incentives are now bring down the cost of
Right.
care.
And essentially, that point's really a great point because it's mind-boggling too. We think about the ACA was about expanded coverage, right? Well, that's great. The expanded coverage of a very expensive thing that keeps getting more expensive. It's just going to be a more expensive thing, right? And so again, how about driving costs down first? Let's get the cost down, and then guess what? Even with the same bucket of funds, you can still then offer more coverage to more people, right? It isn't just about covering more people. We have to bring the cost down to be able to provide that goal.
And nobody's talking about costs in this conversation.
And they did it under Obamacare, and they're not here either. It's just mind-boggling.
Oh, last question.
Yeah, I mean, your role, you have a role that you play also within the, U.S. Chamber and in several state chambers. How can you see your organization maybe leveraging that role to help with this, given that the chambers are oftentimes an impediment to it?
Well, the good news is that we're really a network of job creators. And so we don't necessarily align many times with the perspective of the chambers. We believe in a free market, free enterprise system opportunity, and that competition actually is a good thing. And so from that perspective, we don't really care if we're necessarily not in alignment with the chamber.
This is really the last question. I mean it.
We all understand the theory that this ought to reduce the costs. It would really be helpful for us in Virginia to know what those cost differentials are. For instance, from a state like Pennsylvania, right up the road from us, in Virginia, so that we can, because it seems to me that cost is going to make a bigger difference on the way we approach this issue than some of the free market theories that we all agree with comes to legislators, my next door neighbor, voters. It's that cost differential.
Right. No, I think it's a great point. That's why, Hal, I
That's
know
why-
you've got good contacts with George Mason and Mercatus. I mean, I was actually surprised that as we did this research, that really wasn't out there.
I've already put that bug in their ear.
I mean,
so
that
they're
would be
gonna start
huge.
looking
That would
at
be huge for us, and we'll help in any way we can on that. So.
Excellent.
Anyways,
Alfredo,
thank
thank you so
Appreciate it.
much
Yep.
for having me.
Thank you, everybody.